curious about RSV, RSV stands for Respiratory Syncytial Virus. It is a mouthful, and it is extremely common in children. Now, lately, I've been hearing all about it affecting adults as well. So that's why I wanted to share it because it now has transitioned into affecting adults. So, RSV, like I said, it's very, very common in children. So most children have had RSV by the time they are 2 years old. And more than likely, you never even knew it. Now, if a child is premature or has something else that might be affecting its immune system, RSV can be really, really hard on them. Other children who are completely healthy, they can have RSV and it might just seem like a common cold. So you don't really know. But what I can tell you is that we have been seeing it more in adults and that it is very, 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 very easily spread. Okay. So this virus can actually enter through your eyes, your nose, or your mouth. So a person can sneeze or cough, and the particles literally just kind of hang out in the air. You cannot see them, you cannot feel them. You're just going to absorb them into your body, and that's how you get RSV. Now, not only that, but it can actually live on surfaces like countertops, grocery carts, doorknobs for hours. So one of the main things that you can do to prevent from getting it is if you are immunocompromised, wear a mask when you go out in public. Also, for everybody, wash your hands as much as possible because a lot of it is transferred from the hard objects. So stuff you don't really think about that you touch that a ton of other people have already touched that day. And if that particular person had RSV, then obviously you can get RSV. So some of the symptoms are a barking cough, and this is kind of the trademark symptom of RSV. When children have that high-pitched barky cough, automatically they're going to get treated for RSV because doctors are saying, that's what it is. Don't even have to test for it. It is very, very, very common to have that specific cough. But adults also get the cough. So it's a barking cough, also wheezing, and this can be on an inhale or an exhale. Trouble breathing. And then some of the other ones that I have on here are less common, but are still symptoms. And that's going to be chest pain. You're going to have a loss of appetite. It can actually cause confusion or bluish color of the skin. And that's because it can actually decrease your oxygen level if you are someone who suffers from pulmonary illness. So it can be very, very serious. To prevent it, knowledge is your best prevention, okay? Noticing when someone may have it, making sure that you are wearing your mask, you're washing your hands, try not to be exposed to stuff if at all possible. And also, there is an RSV vaccine. You can ask your healthcare provider if they recommend it. And if they do, get that, follow their recommendations. And also, one thing to remember is that with RSV, it can turn bad quickly. So if you're having these symptoms, you do not want to wait 2-3 days to see if you get better before you go to the doctor. You want to go ahead and go to the doctor because it can cause pneumonia very, very fast. Okay, so just make sure that you're staying on top of things, watching for these symptoms, and call your healthcare provider if you feel like you may be experiencing any of them. Okay, thanks.